So good afternoon. Today we'll be updating people on our projections for the surge in cases that to basically sort of tee up the way we think about at this point in time this is going to play out, and our efforts to ramp up our medical capacity, as well as a few other announcements that are related to the mitigation associated with that. Over the last several weeks, we've put into place several measures that have changed in some respects the way we all live our lives. And we know that this has been extremely hard for everyone. And I want to thank once again the people of the Commonwealth for their patience with respect to all of this. I just want to emphasize that all of the measures that we've put in place have all been about flattening the curve, meaning we've been trying to avoid having cases peak all at once here in Massachusetts, which would overwhelm our healthcare system. And based on the experiences of other countries, we've always expected that there would be a surge here in Massachusetts. So for the past few weeks, we've had a talented group of experts working through the command center with academics, healthcare experts, and public health folks to plan a coordinated response based on the modeling associated with how the surge might appear, what it might look like, and how it would land. And I just want to say that Dr. Fauci said something interesting about projecting the surge the other day, where he said that as every day goes by and you collect more data, not just from your own experience, but from the experience that's going on in other parts of the world, you can rethink and adjust your model accordingly. And that's exactly what we've been doing. But one of the major points I want to make today is the other guidance that he and others have put forth is that people should plan for the worst and do everything they possibly can to make sure they have the capacity to deal with that, and then make adjustments based on changes in experience, changes in data, and changes in other countries and other places' experience as we go. And that's exactly what we plan to do. The medical advisory group that we worked with modeled out with us when we expect to have the surge, how many cases we can expect, and what level of care people will need. We developed these models based on the experience in Wuhan, China, and adapted that to reflect Massachusetts' population and hospital bed capacity. An epidemiologist at Harvard, at the University of Guelph, which is in Canada, Northeastern, and the Command Center's Medical Advisory Committee have been working through and sorting through this data to come up with what we anticipate to be the latest on how this is going to look. We estimate at this point in time that the number of confirmed cases of COVID-19 in Massachusetts will range somewhere between 47,000 and 172,000 cases during the course of the pandemic. That's about 0.7% to 2.5% of the total population of Massachusetts. And at this time, the modeling indicates that hospitalizations would potentially peak between April 10th and April 20th. And the current fatality rate in Massachusetts is lower than in many other parts of the country and the world, currently running at approximately 1.5% of those infected. It's important to remember, as we've said many times, that roughly 80% of those who do become affected have flu-like symptoms, and that many have no symptoms at all. While this model is based on Wuhan's projections, we do anticipate Massachusetts' trajectory could differ for several reasons. For example, in Massachusetts, we have lower population density. We enacted strict social distancing standards and rules sooner than they did there. And we have a lower smoking rate. Our team also reviewed how COVID-19 impacts other states and other countries around the world and lined our projections and expectations up against those. And based on the projected infection rates, our team went to work figuring out what peak medical demand would look like and what it would require to support it. For example, how many people will need to be hospitalized, how many will need intensive care or equipment like ventilators, and for how long. Secretary Sutters and our administration have been actively engaging with our hospitals and the Massachusetts Health and Hospital Association on this issue for several weeks, so that we all are basically working off a similar playbook with respect to what's required to meet the projected need. As I've said many times, we're fortunate to be home to some of the best hospitals and best healthcare leaders in the country with extraordinarily talented medical teams. And just as hospitals plan for an increase in patients suffering from the seasonal flu every single year, we're now planning for COVID-19 with them, but at a much greater scale. We've taken steps to provide hospitals with the flexibility that they need to significantly expand their ICU capacity. We're also asking our academic medical centers and teaching hospitals to expand their ICU capacity. We believe that after hospitals execute on their surge plans, that is, what they believe they need to do with their current resources to add beds, staff, and equipment, more beds will still be needed for both intensive care and for acute care here in Massachusetts. And based on our projections, we believe we need to expand capacity of ICU beds by approximately 500 beds in the coming weeks. And based on our projections, we also know we need more ventilators. And as we've said before, we've been chasing supplies from the federal government and through other sources to deliver ventilators that we've requested. They will obviously be critical to closing that gap. In addition, we're also aiming to find or build out an additional 750 to 1,000 beds using field hospital technology, which is a proven approach that's been used around the country and across the world to create additional capacity to deal with fluid situations just like this one. Along the way, we've also been working on developing other alternative care sites to meet the projected need for both acute level beds, step-down beds, and SNF level of care beds, skilled nursing facility level of care. Yesterday, the Lieutenant Governor and I visited the field medical station that's being set up at the DCU Center in Worcester. It's a 200-bed facility, which will represent about a quarter of the additional acute care need. Facilities like this will help clinicians relieve the pressure on the healthcare system by treating those patients that do not have to be in a traditional hospital at some point in time in their treatment to be treated. This Worcester site is the first of 3 medical field stations that we're working to set up in Massachusetts. The Boston Convention and Exhibition Center has been identified as a possible site for additional capacity, as well as Joint Base Cape Cod and the Mass Mutual Building and other smaller locations around Massachusetts. We've secured a contractor who can build out sites once a healthcare partner has been finalized, and we'll continue to pursue these initiatives over the course of the next week to 10 days. We're also securing 1,000 beds of step-down care options in nursing facilities for stabilized COVID-positive patients. Beaumont Nursing Home in Worcester will provide 300 beds for this important function to protect our seniors. And this step-down plan will help hospitals make room more quickly for new patients once someone gets stabilized. This is a new model we're pursuing based on what we've learned from other areas that have been hard hit by this virus. I'm going to repeat again that we know all models are not perfect, but obviously you need to plan for the worst and hope at the end of the day you don't need to go quite that far. But even with the best planning, we certainly expect our medical system will be stretched. We're going to continue to work around the clock with our healthcare system and with our provider community to prepare for what will likely be a very difficult period. I know there's a lot of information out there for everyone at home. The most important thing I would say is what we've said before, is that we need to continue to pursue the strategies that we've been pursuing to flatten the curve and stretch out and reduce the spread. Stay at home, social distancing, 6 feet apart, wash your hands, hand sanitizer, take this stuff seriously. It is a powerful weapon and has been proven in many cases to be the most powerful weapon of all that we have available to slow the spread of this virus. And if everyone plays their part, we can flatten the curve and reduce the strain on our healthcare system and on our communities. Before I turn the mic over to Secretary Sudders, I just want to comment on some news that broke this morning. I think as many of you know, the Commonwealth received some welcome news, which is a large shipment of N95 masks that will be arriving at Logan Airport later today. Thanks to the generosity and hard work of the Kraft family and many other partners, Massachusetts will receive nearly 1 million N95 masks for our frontline healthcare workers, emergency professionals, and first responders. Most of that shipment will arrive tonight, with more on the way shortly after. I want to extend my sincerest gratitude to our partners in this, and there were many. Ambassador Wang Ping, Chinese ambassador out of New York, played a major role. Dr. Jason Lee, Jean Hartigan, our partners on the ground in China, Tencent, and our COVID-19 Command Center. This was a collaboration between U.S. and Chinese governments and private sector folks and required a lot of support from many entities and agencies along the way. We're grateful that the Patriots plan was able to land in China, load up, and return quickly to the U.S. I also want to thank the People's Republic of China for going to the lengths they went to make this humanitarian aid trip possible. Later today, Massachusetts will receive this vital shipment at a most critical time. Some of the masks, as has been previously reported, will be directed to New York and to New York City, where everybody knows they're very much in the throes of dealing with COVID-19, and to Rhode Island as well, where the outbreak continues to spread there. I think, as everybody knows, securing personal protective equipment is a challenge. From masks to gowns to head covers, our frontline workers critically need the right gear to keep themselves and the folks that they're working with safe. The Commonwealth has been chasing these supplies through a variety of supply chains and requesting gear from our strategic national stockpile. We were able to secure this big order of masks from China, which is a great thing, and we're all extremely pleased to have it finally here. But for a variety of reasons, we always will need additional gear. The Crafts were terrific. They were a phone call away and immediately went to work on the logistics associated with this and did not stop until they could make it happen. This was a total team effort on every level. There is still, with respect to PPE, much more work to be done, but a momentary success like this along the way and all the community generosity that came with it is something that can help everybody working together and keep people healthy and safe. And for that, we are all enormously grateful.